Nasogastric tubes, or NG tubes, are a fundamental tool in modern medicine. They serve critical functions for patients across many different care settings: emergency rooms, intensive care units, and general hospital wards. These thin, flexible tubes are inserted through the nose, down the back of the throat, and into the stomach. This simple device allows healthcare professionals to deliver nutrition, administer medication, or remove contents from the stomach. It is a procedure that, while common, requires skill, precision, and a deep respect for patient safety. This guide is designed to give you that skill and confidence. Our purpose here is to demystify the entire process of NG tube management. We will cover everything from the initial decision to place a tube to its safe removal. This is a comprehensive guide for nursing students, new nurses, and experienced clinicians looking for a clear and concise refresher. We understand that performing any procedure for the first time can be daunting. That is why we have broken down each step into manageable, easy-to-understand segments. Our goal is to build your competence one step at a time, ensuring you feel prepared and capable when you are at the patient's bedside. We will move slowly and methodically. This masterclass is built on a safety-first philosophy. Every step we discuss will be framed by critical safety checks and best practices. Patient safety is not just a concept, it is a series of deliberate actions you must take to prevent harm. We will emphasize the importance of checklists, verification protocols, and continuous monitoring. Misplacing an NG tube can lead to serious and sometimes fatal complications. Therefore, we will be relentless in our focus on how to confirm correct placement before you ever begin feeding or administering medications. This is the most important lesson you will learn. Throughout this guide, we will provide you with the knowledge needed to perform this procedure safely and effectively using a clear, cinematic approach, just as if you were watching a training video with on-screen tips, checklists, and visual aids. This will help reinforce the key takeaways for each section. By the end of our journey together, you will not only understand the how, but also the why behind every action. This deeper understanding is what separates a technician from a true clinical professional. Let's begin this important learning process. The indications for an NG tube can be grouped into a few major categories: visual 4-icon animated graphic, decompression, feeding, medication, lavage. The first and one of the most common is gastric decompression. This is the removal of gas, fluid, and other contents from the stomach. It is crucial for patients with a bowel obstruction, an ileus, or after certain abdominal surgery. By emptying the stomach, we can relieve painful bloating, nausea, and vomiting. A second major indication is enteral feeding, providing nutrition. Many patients cannot eat or drink safely enough to meet their needs. Causes include swallowing difficulties after a stroke, critical illness requiring mechanical ventilation, or certain neurological conditions. Third, NG tubes are an effective route for administering medications, used when patients cannot swallow pills or are unconscious. Finally, NG tubes can be used for gastric lavage. This involves washing out the contents of the stomach. This can be a life-saving procedure after toxic ingestion, or used to clear blood in upper GI bleeding before an endoscopy. Knowing when to place an NG tube is important. Knowing when not to place one is critical for patient safety. We can divide these into absolute and relative contraindications. Absolute contraindications, where the procedure should not be performed, include severe mid-face trauma, suspected basilar skull fracture, or recent nasal, throat, or esophageal surgery. Relative contraindications require weighing risks versus benefits. These include significant coagulation disorders, high-dose anticoagulant therapy, or an agitated patient who cannot cooperate. Ultimately, every decision begins with a careful risk assessment. You must review the patient's history and perform a physical examination. If you have any doubt about the safety of the procedure, stop and seek guidance. This pause for safety is the hallmark of a diligent and professional clinician. Proper preparation is the foundation of a safe and successful procedure. Use a pre-flight checklist to prevent delays and errors. Place items on a clean tray: the correct NG tube, water-soluble lubricant, a cup of water, tape, a syringe, pH strips, and appropriate PPE like gloves and eye protection. Infection control is paramount. NG insertion is a clean, not sterile procedure. Perform hand hygiene, don PPE, and keep the tube in its packaging until you're ready. Beyond the technical equipment, your most valuable tool is effective communication. This procedure can be intimidating for patients. Before you begin, confirm you have the correct patient using 2 identifiers. Introduce yourself and explain your role. I need to place a thin tube through your nose into your stomach to help give you nutrition. Describe why the tube is needed, what you will do, and what they will feel. Use simple language and agree on a hand signal if they need you to pause. Proper patient positioning is crucial. The ideal position is high Fowler's. This utilizes gravity and reduces the risk of aspiration. Accurately measuring the length of the tube before insertion is one of the most important steps. The traditional method is NEX, nose-ear xiphoid. Place the tip at the bridge of the nose, extend to the earlobe, then down to the xiphoid process. Mark this spot clearly on the tube using tape or by noting the centimeter mark. An alternative method is NEMU, nose-ear mid-umbilicus. This method aims for a deeper, more secure placement within the stomach body. From the earlobe, extend the tube to a point midway between the xiphoid process and the umbilicus. This results in a slightly longer measurement. Regardless of the method, consistency and accuracy are key. This careful measurement is your first major step in preventing misplacement. With all your preparation complete, you are ready to begin. Lubricate the first 2 to 4 inches of the tube tip. Gently insert the tube into the chosen nostril, aiming it back and down. Advance slowly until you feel it reach the oropharynx. Instruct the patient to tilt their head forward. The chin tuck helps close off the trachea and open the esophagus. Ask the patient to take small sips of water and swallow. With each swallow, advance the tube a few inches. If the patient starts to cough, gasp, or becomes unable to speak, stop immediately. These are signs the tube may have entered the airway. Continue advancing until you reach the pre-measured mark. Temporarily secure the tube to the patient's cheek. Inserting an NG tube in a child requires a much gentler approach. Tube size, comfort measures, and distraction are key. For infants, you cannot rely on sipping water. Time the advancement with natural swallows while they suck on a pacifier. Pay very close attention to breathing, heart rate, and oxygen saturation. Any sign of respiratory distress. Stop and withdraw the tube immediately. Once the tube is inserted, your single most important task is to verify its position. The absolute gold standard for confirming initial placement is a chest or abdominal X-ray. There are no exceptions to this rule for feeding tubes. At the bedside, the most reliable test is to aspirate fluid and check its pH. Observe the appearance of the aspirate. Gastric fluid is highly acidic. A pH value of 5.5 or less strongly suggests the tube is in the stomach. The auscultation or whoosh test is dangerously unreliable and should never be used to confirm NG tube placement. Once placement is confirmed, you can begin enteral feeding using one of 3 primary methods: bolus, gravity, or continuous pump feeding. Regardless of the method, always keep the head of the bed elevated to at least 30 to 45 degrees during and for 1 hour after feeding to reduce aspiration risk. Follow a strict flushing protocol with water to maintain tube patency and ensure adequate hydration. Ongoing care is a daily responsibility. Assess the skin around the nostril each shift and change the fixation device daily to prevent pressure injuries. Provide frequent oral and nasal hygiene to prevent infection and improve the patient's sense of well-being. Monitor the tube's placement throughout its use. Before every feeding, re-verify placement at the bedside. Safe and effective NG tube management is a core competency. Embrace a safety-first mindset, utilize checklists, communicate effectively, and commit to continuous learning. Carry this responsibility with diligence, care, and professionalism, and you will master this essential clinical skill.